Narcolepsy is a chronic neurological disorder that affects the brain's ability to regulate sleep-wake cycles properly. People suffering from narcolepsy experience excessive daytime sleepiness and may suddenly fall asleep at inappropriate times, even during activities such as eating, talking, or driving. This disorder disrupts the normal boundaries between sleep and wakefulness, leading to sudden transitions into rapid eye movement, REM, sleep and vivid dreams, even during brief naps. Narcolepsy is not simply being overly tired, it is a serious condition that significantly affects a person's quality of life, work, education, and social relationships. Causes and mechanism. Narcolepsy occurs when the brain cannot effectively control sleep and wake states. The disorder is closely associated with a deficiency of a neurotransmitter called hypocretin, also known as orexin, which helps regulate arousal, wakefulness, and appetite. Hypocretin-producing neurons are located in the hypothalamus, a region of the brain that plays a vital role in sleep regulation. In most cases, the immune system mistakenly attacks and destroys these neurons, a process known as autoimmune response. Although the exact cause of narcolepsy remains unclear, genetic and environmental factors both contribute. Certain genetic markers, especially the HLA-DQB1*06:02 gene, are strongly associated with an increased risk. Environmental triggers like viral infections, brain injuries, or extreme psychological stress may also play a role in triggering the onset of symptoms. In rare cases, narcolepsy can develop after infections such as influenza or even following some vaccinations that affect the immune system. Types of narcolepsy. There are two primary types of narcolepsy. Type 1 narcolepsy, with cataplexy. This type includes both excessive daytime sleepiness and episodes of cataplexy, which is a sudden, temporary loss of muscle tone often triggered by strong emotions such as laughter, anger, or surprise. During cataplexy, a person remains conscious but may experience weakness in the knees, drooping eyelids, or complete body collapse. Type 2 narcolepsy, without cataplexy. Individuals with this form experience excessive daytime sleepiness but do not have cataplexy. The cause of type 2 is less understood and may involve a milder hypocretin deficiency or other neurological abnormalities. Symptoms. The hallmark symptoms of narcolepsy typically appear during adolescence or early adulthood, though they can develop at any age. Major symptoms include excessive daytime sleepiness, EDS, persistent tiredness and irresistible urges to sleep during the day, regardless of how much rest a person gets at night. People may fall asleep suddenly for a few seconds or minutes, called sleep attacks. Cataplexy, sudden muscle weakness triggered by emotions. In severe cases, a person may collapse entirely but remain aware of their surroundings. Sleep paralysis, temporary inability to move or speak while falling asleep or waking up. These episodes last only a few seconds to minutes but can be frightening. Hallucinations, vivid and often dream-like experiences that occur when falling asleep, hypnagogic hallucinations, or waking up, hypnopompic hallucinations. Disturbed nighttime sleep, although narcoleptics can fall asleep quickly, their nighttime sleep is often fragmented and interrupted by vivid dreams or frequent awakenings. Diagnosis. Diagnosing narcolepsy can be challenging because its symptoms resemble other sleep disorders or mental health issues such as depression. A proper diagnosis involves multiple steps, including a detailed sleep history and specialized tests. The two main diagnostic tools are polysomnography, PSG, an overnight sleep study that monitors brain activity, breathing, heart rate, and muscle movement to identify abnormal sleep patterns. Multiple sleep latency test, MSLT, conducted the day after PSG. This measures how quickly a person falls asleep in quiet daytime environments and how often REM sleep occurs during naps. In some cases, cerebrospinal fluid, CSF, testing is done to measure hypocretin levels, especially when cataplexy is present. Treatment and management. Although narcolepsy cannot be cured, it can be managed effectively with medication, lifestyle adjustments, and supportive therapies. Treatment goals focus on reducing excessive daytime sleepiness and preventing episodes of cataplexy or sleep paralysis. Medications. Stimulants such as modafinil and armodafinil are commonly prescribed to promote wakefulness. Sodium oxybate helps control cataplexy and improve nighttime sleep. Other medications, like antidepressants, SSRIs or SNRIs, are used to manage cataplexy and hallucinations. Lifestyle modifications. Maintaining a consistent sleep schedule, taking short daytime naps, avoiding caffeine or heavy meals before bedtime, and engaging in regular exercise can help control symptoms. Patients are also encouraged to avoid driving or operating machinery when drowsy. Impact on daily life. Narcolepsy can deeply affect daily functioning. Individuals may struggle with concentration, memory, and performance at work or school. Misunderstandings about the disorder can lead to social embarrassment or isolation, as others may perceive the person as lazy or disinterested. Emotional challenges such as anxiety and depression are also common, emphasizing the need for psychological support and education about the disorder. Conclusion. Narcolepsy is a lifelong neurological disorder characterized by uncontrollable episodes of sleep, cataplexy, and disrupted sleep patterns. While its cause lies mainly in the loss of hypocretin-producing neurons, genetics and environment both play important roles. With appropriate medical treatment, healthy lifestyle choices, and social understanding, most individuals with narcolepsy can lead fulfilling and productive lives despite the challenges posed by the condition.